Welcome back. Tonight we're talking about the so-called stomach bug, specifically norovirus. Cases of norovirus are sweeping across the U.S. and hitting the Northeast especially hard.
But how are case numbers here in Connecticut? We're joined by Dr. Ulysses Wu, Chief Epidemiologist and System Director for Infectious Diseases for Hartford HealthCare. So Dr. Wu, thanks for joining us. Are we seeing an uptick here in Connecticut? Are there more cases?
Yeah, so thank you for having me again. Definitely, it is norovirus season, which we typically would see from November through April. And we are certainly seeing a rise in cases, not just people coming into the hospital, but people in the outpatient setting. And it's just not the Northeast, but it's been increases in Michigan and especially in the West as well.
So let's talk about symptoms here. Norovirus, as we understand it, is not fun. What does it look like? How do we know for sure we're talking about a norovirus here?
Well, you never know if you're talking about for sure norovirus unless it's actively tested for. But most of the time, you can kind of get a sense if we're in the season and they have symptoms of what we would say nausea and vomiting, as well as possibly diarrhea, fever, and headache. And we're in the right season and they've maybe had some exposures. They're in a close setting, such as a college setting, nursing home, military setting. Then certainly it is a possibility that is norovirus. But I will say there's a couple other viruses that are circulating, both respiratory and GI, and even some of the respiratory viruses can give you abdominal GI type symptoms. But when you got noro, a lot of times we really suspect it based off of the symptoms.
Okay, so who is getting the sickest? You rattled off some ways that people might think they've contracted it, right? Who they've been around. Is this affecting children as well? A lot of pediatric cases?
Yes, unfortunately, it does affect children, and it affects both extremes of age as well. And it's not normally what we'd say a deadly disease, but about 900 people die every single year. So it is deadly to a certain extent. And most of that is in the age range of what we would say the elderly population as well. But yes, there are risk factors that are associated with it, the ones that I've kind of mentioned. Clustered settings, again, college settings, schools, daycares, nursing homes, military settings, where there's going to be a lot of close contact and questionable hygiene, I will say.
Well, let me ask you kind of a two-parter here. First, how does norovirus spread, which leads directly to then how do we protect ourselves?
Yeah, so it is spread by what we call fecal oral, and we don't mean that you're actually eating somebody else's feces. It is actually the bacteria or viruses that are associated that can get you ill. And so what happens is that somebody will be sick and they won't perform good hand hygiene. They may spread it to another surface. Somebody may touch that surface, or they may come in contact with that person. But it is also spread through food sources as well. And so in the past, you've probably heard leafy greens, shellfish, fruits and vegetables, things like that can also harbor this virus. I think the most classic case that you always hear about in the news a couple times a year is the cruise ship. And so that's, again, you're spreading it in those close quarters.
All right. Thank you, Dr. Wu. We appreciate it. And as somebody with a preschooler, I know it's going around. A lot of parents are, there's, this flu season and the norovirus, it's too much. So
thanks for your advice.
Safe. Yeah. Thank you.
Wash your hands. That's the best way to protect yourself.